Sleep apnea is a common sleep disorder that occurs when a person's breathing is interrupted during sleep. Patients with untreated sleep apnea stop breathing several times during their sleep, from anywhere from 5 to 30 times per hour. Typically, the breathing starts again with a loud snort or choking sound. There are two types of sleep apnea. Obstructive sleep apnea, or known as OSA, is a blockage of the airway, usually when the soft tissue and the back of the throat collapses during sleep. Central sleep apnea, the airway is not blocked, but the brain fails to signal the muscle to breathe due to instability in the respiratory control center.
When you breathe, air travels down your throat, through your windpipe, and into your lungs. The narrowest part of that pathway is in the back of your throat. When you're awake, muscles keep that pathway relatively wide open. But when you sleep, those muscles relax, allowing the opening to narrow. The air passing through this narrowed opening may cause the throat to vibrate. That causes snoring, which many people experience. But in some people, the throat closes so much that enough air can't get through to the lungs. When this happens, the brain sends an alarm to open the airway. Most often, this is associated with a brief arousal from sleep. The brain quickly reactivates the muscles that hold the throat open, air gets through again, and the brain goes back to sleep. This disorder is called obstructive sleep apnea.
Why is this a problem? Well, the frequent drops in oxygen level and reduced quality of sleep trigger the release of stress hormones. Risk factors for sleep apnea: male gender, being overweight, greater than 40 years old, large neck size, which is 17 inches or greater in males or 16 or larger in women, large tonsils, tongue, or small jawbone, family history of sleep apnea, GERD, or nasal obstructions such as a deviated septum. Symptoms of sleep apnea include excessive daytime sleepiness or a report of lack of energy during the day, waking up with a very sore throat or a very dry throat, loud snoring, waking up with a choking sensation, sleepiness while driving, morning headaches, restless sleep, forgetfulness, mood changes, or irritability, an inability to concentrate, or recurrent wakings or insomnia. And oftentimes it's the partner that will report, the sleeping partner that will report some of these symptoms. Effects of sleep apnea, or sleep apnea, has actually been linked to hypertension, heart attacks, stroke, obesity, heart failure, irregular heartbeats, diabetes mellitus, depression, or worsening of ADHD. The treatment for sleep apnea: lose weight, avoid alcohol or sleeping pills or other sedatives at night, changing positions to promote regular breathing, such as sleeping on your side, and stop smoking. And some people, to avoid sleeping on their back, will actually use a tennis ball stitched into their t-shirt to prevent them from rolling on their back at night. CPAP is the #1 way to treat sleep apnea. CPAP is a mask that's worn over the nose and or mouth. The mask is hooked up to a machine that delivers continuous flow of oxygen into the nostrils. The positive pressure from the air flowing into the nostrils helps keep the airways open so that breathing is not impaired.
CPAP, which stands for Continuous Positive Airway Pressure, is a treatment option for sleep apnea. The airway pressure is provided by a machine at your bedside that either blows air through small tubes in your nose or through a mask which fits over your nose. As you sleep, pressure is continuously supplied to the back of your throat. The pressure of the air keeps your throat open. This often ends the cycle of waking and falling asleep, as well as snoring, both of which may keep others awake. The CPAP machine doesn't breathe for you. You can continue to breathe in and out normally on your own. A variety of masks are available. If one type of mask isn't comfortable, ask your doctor for suggestions about where to find the best mask for you.
Other treatment options include dental devices that can be made to open your airway during sleep. There are nasal surgeries to correct the deviated septum. Sometimes people get removal of the uvula in the back of the throat, which increases the width of the airway of the throat. And sometimes mandibular surgery is used to correct facial abnormalities or throat obstructions. Some of the side effects of the CPAP machine that patients report is a dry or stuffy nose, irritated skin on the face, dry mouth, or headaches. However, most of these can be corrected by adding moisture to the CPAP or using a nasal spray to correct some of the dry or stuffy nose. And then a variety of masks are available. So if you're not comfortable with your CPAP device or it doesn't seem to be working, you can let your practitioner know and they may need to switch to a different device or a mask. The way to diagnose sleep apnea is a polysomnogram or a home sleep study, which essentially measures a variety of things, including heart rate, blood pressure, O2 saturation in the blood, and a sleep specialist will analyze the results of the sleep study and determine if you have sleep apnea and to what degree. So your alternatives for doing a sleep study in the traditional lab setting is there's devices, home-based portable devices that you can take home and you can do the sleep study in the comforts of your own home. And it measures various details that, again, go to a sleep specialist who interprets those results and gives you either a diagnosis of sleep apnea or not. The device is very small. You take it home and there's directions and it's very easy to apply. And people like the benefit of having to do the sleep study in their own home because of course they feel more comfortable